Okay. Welcome back to Track 1, Capacity Building, and we hope you enjoyed your morning break, sponsored by Bio, and are ready to dive into our first breakout session today. My name's Angie Rowe, and I'm the COO at Global Genes. I've been there about a year and a half, so this is my second summit with the organization, and we're just so excited to have you guys all here and participating, and we hope that you're having a good time. Please be reminded that we are live streaming through Platform Q, and I would like to welcome our remote attendees. Without further delay, I would like to introduce our first session of the day, Developing Volunteer Leaders to Expand Your Organization's Reach and Services in the Community, presented by Louise Vetter, President and CEO of Huntington's Disease Society of America, and Eveline Honig, Executive Director of the Narcolepsy Network. Please join me in welcoming them.
Good morning, everyone. It's nice to be here, and thank you for joining us. We're thrilled to have such a large room full of so many exciting people. So Louise and I will talk about developing volunteer leaders, which is a very important part of nonprofit organizations, as you know, and it's wonderful to have a lot of volunteers, and it's also difficult to develop. So we would like to make this very interactive. So we will show a slide, and then we hope that you have questions. It's a little bit hard for us to see with the bright lights, but so raise your hand clearly if you can, or shout out that you want to say something. And we will hopefully have an answer, but we also hope that you have answers. So the first question is for, the first slide is for me. A board of trustees is very, very important in an organization. In my organization, Narcolepsy Network, and I haven't really said much, just briefly, narcolepsy is a neurological sleep disorder. We have a large organization, not as large as Louise's, but we have very few staff, and we really depend on our volunteers a lot. My board is very, very active. A lot of the board members, we used to have a president who would work 40, 50 hours a week, and as a volunteer president. So it's very difficult to have a good board, as some of you probably know. Some people are not in it necessarily for... I should first start with the positive. We have a lot of wonderful people with a lot of talent, dedication. They want to make this a better place. They want to make narcolepsy heard. They want to help people with narcolepsy. At the same time, I deal with board members who, have their own agenda. And it's sometimes hard to deal with this. I mean, Louise, you want to add something to that?
Yeah, volunteer management is a challenge, and you're going to hear that theme throughout our slides. We've decided in this presentation to start by talking about the grass tops, which is a little bit backwards perhaps, because all of our organizations start at the grassroots. But we wanted to really structure this from the perspective of who's leading the organization and really show that we are volunteer run. And from that perspective, some of the challenges that comes with it. Eveline spoke a moment about her organization. So Huntington's disease is a rare disease. We have about 30,000 people who are symptomatic. We have an additional 200,000 who are at risk. And who in the room has heard of the name Woody Guthrie? Okay. Generations keep passing, and fewer people know who Woody Guthrie is. But he was a very famous songwriter. And when he passed of Huntington's disease in '67, his wife, Marjorie Guthrie, established what is now the Huntington's Disease Society of America in the truest grassroots fashion. She put an ad in the New York Times asking for families who had experience with Huntington's disease to, at that time it was called Huntington's Chorea, to give her a call and to essentially come around her kitchen table and very grassroots plan what they could do to make an impact in the fight against HD, to raise awareness, to increase funding for science, and to build clinical care. To how many of you does that story sound familiar? Okay, that's what patient advocacy is. It's somebody reaching out, creating a community, and affecting change. And that means volunteers coming together like a magnet to one person at the beginning, and then moving on to create a structure that is creating reach and impact. So at HDSA, our board still very much embraces what Marjorie Guthrie set forth as volunteer-driven and volunteer-led. We have 16 board members. We've chosen to keep it on the smaller side. So we are never more than 20, and we are often not small, we're almost never smaller than 15. And we do that for a lot of reasons. We want to make sure that all of our board members are equally engaged, that they have stuff to do. 75% of them come from HD families. That's incredibly important, but we also make sure that there's 25% or so that are corporate representatives or maybe scientists or clinicians who come at it from more of a professional interest. And we do, and this is a little bit controversial, but we have found it as a best practice, we kick them off. So we have term limits that we take very seriously. Board members can serve for up to 6 years, 2 consecutive 3-year terms. And we do that very deliberately. For volunteer leadership, we think it's really important to be embracing new ideas at the national level. And I say this is controversial because I know that it's really challenging for a founder of an organization to step down. But we have found that for the health of our organization, and we're almost 50 years old, that it's really important for us to be cycling through new volunteers. And I know you have term limits as well, right?
We have the same. We have 2 3-year term limits, and some board members are so wonderful. I don't ever want to see them go. I've been at this organization for 12 years, so I've been around longer than any board member. But then there are other board members. I always struggle with, we're looking for good people, dedicated people, people who want to put in time, but then they ask me, how much time should I think, how much time do I need to devote to your organization? And it's a difficult question. I don't want to scare them by saying 10, 20 hours a week, because some people do it that many hours. But what is reasonable, and what exactly do you look for in a board member? We need someone right now who has a financial background. But we also need good writers. We need people who can fundraise. We don't have enough of that. So it's how do you get a good board member? Do you put an ad in the paper? Do you put an ad in your own newsletter? Do you look around in your community? Or do you wait for people to come to you? All of those happen. And I would be interested to see if any of you have some ideas about how to find a good board member.
Why don't we move forward? Questions will come.
Yep, okay, so maybe if you can think, there is someone who...
In the back in the blue. I'm sorry, I have to. Okay, I'm going to come.
I'm not sure I have an answer, but I have a very tough time with this. And some people start out with volunteers and see how the volunteers go and then grow them into board members. And I've tried to do that too. And then once they become board members, then they don't want to help you. They say, well, you're just, I don't have that kind of time. I have a family. I have this, I have that. And you're asking me to devote all this time, and I'm just asking them to have a meeting once a month. And they can't even do that. So it seems like when they transform from volunteer to board, it's a nightmare. And they really lose their desire to help you do anything. And
So-
I'd like the guidance on how to do this, because it's very difficult.
Well, I think-
I recruited a college student to be a web designer, and she's actually more devoted to me and to this effort than the board members are.
Thank you for that feedback, and
Yeah.
it's really true. All of our board members on the national board have grown through the organization. And so I think as we move forward, we're going to talk about the different opportunities for volunteers to get involved at lots of different levels. What we have found is really helpful at HDSA is to have a board member job description. So after we've cultivated somebody up, we really have a very clear job description of how they're going to be expected to contribute to the organization at that level. Some of it's a giving policy. Some of it's an expectation of time, how many committees they need to serve on, but we really try and be explicit so that we're managing expectations on both sides. What we don't want is somebody on the national board who doesn't have the time and doesn't have, really doesn't value the input process that we need all of our board members to contribute. What I don't want at HDSA is a group of trustees that's rubber stamping things. I want good debate. So we have a variety of different roles for our board members, and I specifically seek out trustees who are going to bring a different perspective. Because from my perspective, it's very difficult to build a really accountable, transparent, forward-thinking organization if you have the same mindset in a circular motion. So we challenge ourselves to welcome new people, and that's what the term limits provide. We also, so below the board, we have different committees that provide a feeding ground for the board. And I know that at narcolepsy, they have a medical advisory board, and I have a few committees. Why don't you talk about yours first?
Yeah, we actually do this process as well, but sometimes people kind of have a talent and have a desire to be on the board, so that we kind of take them on the board. Sometimes that works because they're fresh and new, they seem to be interested still. But I know that phenomena, and that's an odd thing, that people are excited to be on a committee and then all of a sudden they're on the board and they seem to lose interest. So we could, maybe talk about that later. But yeah, we have a medical advisory board as well. It's very different. They have a very minor role. We ask them questions sometimes about medications or medical issues, or even to write an article for us. Some are more active than others. They come to our national meeting. They give presentations. But generally, they're not required to be part of a monthly meeting, which we have as well, monthly board meeting, and an annual meeting where they have to be in person. So there was one other question. How are we doing in time?
We should probably move forward.
Okay, so let's move forward and we can come back to your question or your comment. Okay, oh sorry.
Oops, that's okay. So Eveline mentioned the medical advisory committee that she has, having a relatively minor role as advisors. At HDSA, we have several committees that feed into our board, so they're board committees, and two of them are mentioned here on the slide. We have our scientific advisory board, and we have a horrible acronym called CPAC, which is the Center Program Education Advisory Committee. I feel like in the land of rare diseases, there are way too many bad acronyms, and this is one of the bane of my existence. But both of these committees are incredibly important to HDSA because they are where our scientific leadership and our clinical leadership reside. So these are all volunteers, and they actively shape the mission work of our organization. Our cornerstone programs, which are our Centers of Excellence program, we provide funding to 39 comprehensive care centers in Huntington's disease. And our research program, we have a human biology project because I don't care about curing mice. I care about curing people, which is the only place where Huntington's disease naturally occurs. So we've really organized our committees to focus in those ways. And they're all volunteers. They're global representatives on the scientific committee, but they are national on CPAC, and that's because of the unique state of the US healthcare system. And they are active. We reach out to them with questions. We expect them to work, and that means having monthly teleconferences. They gather at our annual convention to review things, and they have in-person meetings at least once a year to talk about the key issues facing the organization. So again, as we cultivate volunteers and we find really passionate scientists and really passionate doctors, we look for ways to funnel them into these groups, which are never more than 15 members strong. And this is a theme that you'll hear from me, is that it's good to have a good number of folks, but if you have too many, it can quickly become unwieldy. And so we're really careful about keeping our groups to between 8 and I would say 14 members, so that everybody has an opportunity to participate, influence. One person doesn't dominate the group in terms of perspective, and we have found that to be a really, really successful mixture.
Okay, so we We try to get everybody involved at Narcolepsy Network. We have sometimes volunteers, their parents, or because people with narcolepsy tend to be very tired and sometimes don't have the energy to do things. So we have a lot of people like parents, children, spouses who are involved with the volunteer work, with support groups, with walks. We have a father who's also a board member who's always doing an annual bed race. And this is very interesting. He's doing that in Virginia, and it attracts a lot of attention. It's mostly to raise awareness, which is a very important part of, as you all know, raising awareness so that the community knows or starts to know about your disease or disorder. And this is great for us because he gets a lot of press and with his bed race. So it's wonderful. We sometimes we even have friends who do things. We had a woman who said her friend had narcolepsy. She wanted to do something for her, raise some money, raise awareness. Sometimes those two can go together. And she said, I have a restaurant, can I do something in my restaurant and invite our community to come and eat here, and we will donate the food, and then she can talk about what it is to have narcolepsy, and she will at the same time hand out some brochures. And in fact, very often, one or two people are diagnosed on the spot. The problem with narcolepsy is very often that people don't know that they have it. There's still 10 years between first symptoms and first diagnosis, so that's a real problem. So we have jobs for, we'd love to get all kinds of people involved, not just the person with the disorder. And so we hope that all of you are doing this as well. And again, if you have a question, want to say something right now, please feel free.
While we're waiting for the mic to move, I also want to mention that we're all friends here, and I know that the room is packed. If in the back you want a place to sit, come on down, grab a seat on the ground, make yourself at home. If you have your bag on a chair, please make room for somebody, because we've got about 10 people in the back. That'd be great to be able to accommodate them.
And there are 2 seats right here, and one over there, here in the front.
Okay, you had a question.
Yeah.
Yeah, as far as recruiting advisory board members, wonder what specific tips that you can give. I mean, you mentioned 8 to 14 people. We have 5 on our board. You mentioned term limits. Are rare diseases beyond ultra rare? It's such a small pool of humanity. If we rotate people off, how are we going to replace them? We have hard enough time getting people the way it is. How do we expand beyond it being mom and dad? We need input in other sets of eyes, and we have not been successful in getting anybody else other than mom and pop.
So I would say that I applaud you for being such a passionate small group, and that is incredibly difficult. In terms of attracting new folks, it really means constantly scanning the environment for the person who cares. It's as simple as that. The person who cares, the person who comes to a bake sale, who sits in an audience as you are talking about the disease and maybe asks you a question afterwards. And remembering that every level of participation is volunteerism. And my slides hit upon this a little bit more, but donating is volunteering. Participating in a survey is volunteering. Coming to a walk, taking interest, that's a thread of volunteerism that you can pull out. And so I think something that we've done at HDSA is we've really trained everybody to constantly be scanning the environment for that inkling of passion that we can then turn up. And also making sure that you start with really small expectations for those volunteers. Don't invite them to go right on the board, because that's going to scare the heck out of people. People have an image of what it means to serve on a board that can be incredibly intimidating. But have a very specific pipeline of how you're going to move them up. It took a long time at HDSA for us to rotate folks off of the board, for us to get to a place where we felt confident in our pipeline. But it's something to aim towards. And maybe it's not 6-year terms, maybe it's 10-year terms. Maybe it's planning on rotating one person off every 3 years, just to give them a break and to force yourself to find somebody new. So what we're talking about are our best practices, but definitely tailor it for what makes sense for your group. But I think the key is, and some of our examples will go into this, is thinking how you think about volunteering for your organization and how you can cultivate them up, because that's really, at least for us, so important.
Right. And I want to add to that, we sometimes have that problem as well. To get good board members, and then you feel like, oh, there is someone, let's take them. I think that's a bad attitude. Just because somebody wants to do it, you need to make sure they are the right person to be on a board. But you know, sometimes there is somebody else that you really don't think about, like a nurse who helps treat you or your child, or who's very a passionate person about the disorder, and she wants to, or he wants to know more about it, and sometimes they're interested in being on your board. They don't necessarily have to have the disease or a family member of the disease. Sometimes it can be someone, or a school nurse, if they're a particular nice passionate person who knows? I mean, they may want to do something like that. And so I think that you should think about people like that as well. And I should really add, make it a little bit fun too sometimes. My board members sometimes complain the calls can get we have one member who's particularly aggressive. We always have a dinner once a year, and I really don't want to talk about board issues then, and just have fun, get to know each other, have a board dinner. I mean, at least there's a little bit of money we spent on a nice board dinner, and I think it's important that we have fun with each other, and at least once a year, and not just talk business. And sometimes they say to me, this is a volunteer job, but I'm getting a high blood pressure from these board calls. And you just don't want that to be the case. You want them to have fun. I mean, and board members have left because they're annoyed with somebody else. And so sometimes it's like being in high school with your board, because they fight with each other, and they call you like, I can't stand her, and then she's saying this, and so it's really important that you have fun too.
Yeah, we are all stewarding communities, which means I think all of those dynamics that happen, and I love the high school comparison. There are the cliques. There are the groups of volunteers who are really passionate about something, and you have to sort of manage that around. Now, I know that I'm with a large organization, and so the example that I'm going to talk about sort of how we continue to organize people up through the pipeline may be challenging, but I wanted to share that. So we have our national board, we have our committees, and then below that, not in value, but in structure, are our chapters and affiliates. So we have groups of families in 54 places around the country that have self-organized, which means they have decided that they care about the work that HDSA is doing, and they have come together to raise funds for the fight and be able to develop their own programming. And we try and make them autonomous. And I say this, it's kind of like a franchise model. Not that we're McDonald's, we're a heck of a lot healthier and more noble, but if folks want to organize to be a chapter or an affiliate of HDSA, and I should say affiliates are just chapters in training. So affiliates tend to be smaller, and they sort of grow up to be chapters. And we have very specific definitions of what it means to be an affiliate or a chapter. You come to HDSA, we're going to give you a handbook on what it means to organize and sort of the minimum requirements. So as an affiliate, you have to have 8 people in your community who have agreed to care about HDSA's work and to support our mission. And that means improving the lives of everyone affected by HD. And so you start with those 8 people, and then you develop a budget, and that's really the goal that you want to raise in your community, and then how you plan on spending those dollars. So if you raise $5,000 at a walk, how are you going to spend those dollars? And in many places, it's running support groups. It's buying a few social worker hours. It might be sending the money to the nationwide organization, to the national office, so that we can put it into research. But we let our local volunteers decide how the funds they raise are going to impact the organization. Now, I have staff in New York City that do fundraising for the nationwide organization, so we complement the work that's going on in the chapters and the affiliates. And we do that specifically because we want the volunteers to have a lot of say of how the dollars they're raising locally are spent. But there are things that we need to make sure we're doing that are going to resonate nationwide, like our website, like our research program, like our centers of excellence. So for us, we have the reach to be, both locally present with local volunteers, but then also have volunteers shaping our national agenda.
Okay, next.
Oh, we have a question right down front.
Are your local chapters unique 501s that are guided by your national organization? And how do you manage that if they are?
Great question. They have local EINs, so they can do business in their state, but we are organized as a consolidated organization, and we all function under one 501c3. So that allows us the benefit of leveraging the work of a core staff so that the volunteers don't have to worry about that paperwork. And that was really important, and it was a challenge. That change actually came about 10 years ago. We did this consolidation to be able to file as a group because we didn't want to have to worry about the overhead costs of having staff with each chapter and affiliate. We need to put more money into the mission work, not spending money on more staff. And so we very deliberately did that in a way so that all of the paperwork can happen in one place.
Right, so what is your reporting mechanism from those local chapters then as far as where their spend is? Because you're going to have to report
Yeah.
that, right?
Yeah, so the question for everyone in the room was, how do those chapter and affiliates report? And we have every chapter and affiliate has 4 officers, so they all have a president, a vice president, a secretary, and a treasurer. And the treasurer is responsible on a monthly basis for sending us the local revenue and expenses. And we have an online portal where they can upload the information. We make it as easy as possible so that the accountant in my office can pull all that information and be able to monitor it. And then at the end of the year, we do a full reconciliation. But we do expect the treasurers to be sending in all the information. From a very practical perspective, I'm a signer on every bank account. Not that I go to the bank of every chapter and affiliate, but because we have to have those controls in place to make sure that there's one staff person who's able to intervene if we need to. We place an exceptional amount of trust on our volunteers, in our volunteers. We really do. It's an honor code. We have to train our volunteers to be able to steward the monies of the organization and then make sure that they're sending the information upwards. And our auditing process is really robust, but I come back to trust.
Yeah, we don't really have chapters. We have more support groups, and so it's not like in your organization. We have some areas that are active. They get some of our financial support to run the groups, so we would like to see more active, but Global Genes has been very generous and has been organizing some local meetups. So we're hoping to continue that next year in 4 different parts of the country, specifically where we don't have a lot of presence, and sometimes in places where there are no support groups, and our annual meeting in some places is too expensive, like Chicago, New York. It's too expensive for us to have meetings there. We try to go to places where the hotels are a little cheaper.
One more question.
Yeah.
In the fundraising that your local chapters do they affiliate with industry, or is it private donors in the community? And wondering if they do affiliate with industry, how you manage those relationships as a national organization.
So the question was how the local fundraising events, generally how they're receiving their funds and how those relationships are managed. So we're very special event heavy as an organization. 75% of our income is coming from special events like walks or dinners or lawnmower races, or we have a goat that you can take your picture with, and every time a picture is taken with the goat, we get a donation, which is awesome. And somebody's reacting like they have a goat too, so you can steal that idea. So those volunteers, the individual gifts are very easy to track. A lot of it's online donations, we acknowledge them. On the corporate level, we're running long. I knew this was going to happen. On the corporate level, if it's a local company, then it's managed by the local volunteers. If it's a nationwide company, then we're organizing it at the national level and we're providing information down. So we have a partnership with a national pharma company. We make sure that every chapter and affiliate knows how to work with that company for the year, and we just try and keep the communication flowing. All right, each
So
of us
we-
have a few examples.
Yeah, we just give some examples of some great volunteers who have something special, and one of them you probably saw is Nicole Juret. She's a professional golf player, and she's been very active. She's doing this program, Swinging for Sleep. It's great if you have someone like that in your community. You should really hold on to them. The best is, of course, if you have a famous celebrity, but because that usually gets a lot of interest and funds. So yeah, this is one example. We do want to keep some time for questions, so. Yeah, we have, and we had this young couple. This guy, this was in a college in Oklahoma. His girlfriend was diagnosed. They were both in college at Oklahoma State. He contacted me. He said, "I'm putting a big concert together." And it cost a lot of money for him too. So in the end, he raised $2,000, and it was fabulous. It was a great concert, and these kinds of things are really wonderful. When people do this, you should embrace it. It's not a huge amount of money, but it's raising awareness. They're young people, and I loved it. I thought it was a great idea. Move on to the next. So yeah, we have a whole group of volunteers at our conference. Our annual conference will be next month in Orlando, and we're lucky to have a huge group, people who are at the doors, like she was just announcing us, who tell us that this many minutes. These are all volunteers for us. Even though we have a conference meeting planner, we still rely on so many people doing this work for free. So it's very, we give them conference registration, but sometimes I feel we should give them more than just a thank you, a recognition. We do have a Volunteer of the Year program at our conference, so we make a big deal out of somebody who's been really doing a lot of special work, and so they get a plaque. They speak in front of 500. We announce this in front of 500 people. They can get a little thank you speech in there, and it's a wonderful thing. People really love to be recognized like that. So that's another thing we do for special people. And we have a youth ambassador program that we just started last year. These are kids, high school, and now we expanded to college age. They usually have narcolepsy or a brother or sister with narcolepsy, and they go out to the communities or any type of thing, Rotary clubs, schools, parent-teacher association meetings, or even doctors or insurance companies. And they talk about narcolepsy in a brief speech. It's a win-win situation. The kids use it for college applications. They learn how to speak in public. And at the same time, people like to hear from, instead of old people like us, well, you're not that old, but, but they like to hear from young people. They like to hear their stories, and they may not be the best speakers, they may be shy, but it's interesting. It works really well, and we actually learned this from the Tourette Association of America. They have a fabulous youth ambassador program. So, yeah. Then we have walks. We had a big walk in New York City, and as you could see, the bottom picture is the bed race that I mentioned before. The walks are really a great success, and I think Louise has a lot of them too. For us, they don't raise a lot of money. We try to keep the cost down, but the New York City one is always fun in May, and we have about 100, 200 people. So it's a great way to raise money and awareness.
I know we're short on time, so I have 5 slides that I'm going to breeze through quickly. But the important thing to know here is that both of us are available throughout the rest of the conference, and we can certainly linger after our official time is up to talk more. I want to just emphasize a few quick things that I think parallel what Eveline mentioned. First of all, volunteers shape all of our programs, and that happens through, at HDSA, our chapters and affiliates, our board committees, and then the national board. But this is a model that we use just to show that everything we do is for HD families and honestly by HD families. And so from retaining social workers to community education events to funding our centers of excellence to influencing long-term care. Imagine if you're 40 years old and need to go in a nursing home. You need to depend upon the support of other families who have gone down that path before, and they can be incredibly valuable resources. So that's how HD families provide a cycle of support in our organization. Every volunteer for the organization carries the mission, and we really count on everybody being ambassadors in the truest sense. And that means they are raising funds to support groups. They're directly raising funds to retain social workers. We have 40 social workers that are hired by our chapters and affiliates, so volunteers hiring these social workers and managing them. And then really incorporating them in all of our educational feedback. This is an example of direct volunteer and family influence. So Huntington's disease is a genetic disease. If one of your parents has it, you have a 50-50 chance of getting it. If you want to be tested for the disease, then you have to talk to a genetic counselor. That process, however, can vary greatly and can be incredibly traumatic or very supportive. And so we put a survey out, and more than 700 families contributed their knowledge, experience, and perspectives, and it completely reshaped our best practices in genetic testing protocol. So families providing a white paper that went to all genetic counselors and is now the best practice that's being used by all HD clinics around the country. So don't ever underestimate the value of your families and volunteers, and proactively put that information out there. Survey participants are volunteers, don't forget that. Volunteers are ambassadors, so carrying research messaging. We need everybody involved in clinical research at every level. So we train some of the volunteers who are most comfortable with public speaking and who have been a part of clinical research to go out to support groups and help break down the fear. We don't want there to be a delay in treatments because people aren't participating in science, and our ambassadors help speed up that process. And we also, much like We Are More and what Eveline mentioned, we have a youth program. We call it the National Youth Alliance. They are an incredibly inspiring group of people who are changing the way their families think about HD and really challenging all of us to be more forward-thinking in what we expect from care. So this is my favorite quote: "Silent gratitude is of no use to anyone." So we specifically set aside 2 days a year where all we do is thank people. We've called them Thank You Thursdays, and so we usually do one in November, we usually do one in March or April, and it is a day when all of our staff, all of our leader volunteers just call people to say thank you. You don't ask on that day. You just say thank you. And we celebrate everyone's contributions throughout the organization on a daily level. And then also, of course, at our convention, we give out awards. But I just reiterate this, that I think it's important to set expectations for how people can volunteer as they want to grow up in the organization. Job descriptions can be helpful. But you also need to take the time to just recognize that they're giving so much, and we want to make sure that we thank our volunteers consistently. Our tagline is "Family is everything," and we really talk a lot about the we, not the me. It may come from you personally, your inclination to get involved in the fight against HD, that's the me, but it's powerful as a we, and so we talk about that dynamic a lot. You want to?
Yeah, I think that this you can read. This speaks for itself. We have a few minutes left, and I would really love to hear if there's some comments, or maybe somebody has a great volunteer remark program that they think works really well.
We'd love to hear from you. We don't have all the answers, trust me. There's a question over here.
Hi, I'm Terry Klein with the National MPS Society. I just wanted to share that although it might seem daunting, one of the successes that we've had with our volunteers is when you had said what you said about scanning your environment and looking for people at all times that might be interested to help you out. Sometimes follow-up is everything, and follow through. And it's hard to follow through. And sometimes those follow-throughs take 2, 3, 4 years, and it might seem like it's daunting. But when they pay off really big. And so just because someone doesn't respond in the first year or two, but you know they might be a good candidate, find those warm approaches to them, because those have been real successes for us. And I just wanted to share that follow through.
I think that's so important, the cultivation. And actually, this
Right.
brings up a point that Eveline and I were talking about at breakfast, and it's how you manage volunteer relationships in your organization. Do you have one person that's a volunteer organizer and a volunteer trainer, or do you spread it across the entire organization and make everyone who's involved responsible for that cultivation process? I ask everybody to be aware of it and do it, and I train everybody on it, just because there's so much for all of us to do, but there'd be real value in having a dedicated person who can make sure that all of it's coming together.
Yeah, we're thinking of getting a volunteer manager, but I'd like to hear from the next person.
That
Last question, I was
I'm
told.
so sorry. It was just a follow-up basically on what you just said. So I was going to ask about your training program. Did you develop that? Did you write it down? How long did it take you? And then who executes it? So, but you kind of answered that, but maybe how you developed it was my main question.
Well, we actually are we're wondering what to do. We try to get a volunteer manager. Should that be a volunteer? Should that be a paid person? We're debating that now. We're looking into what we should be doing. So it's something that will come up in our next board meeting.
So we have a welcome kit for all volunteers. We have toolkits so that if somebody wants to put together a walk, we can give them those fundamentals. And then as they grow through the organization, we sort of have resources that helps train them as they grow up within HDSA. But as mentioned, everybody sort of does it, which means that probably on some level, no one's really doing it. And that's something that takes a lot of cultivation and a lot of consideration. Thank you all for being such a wonderful audience.
Thank you very much.
Being here.